Hey everyone, my name is Mica Wolcott, and I'm a licensed clinical professional counselor in Montana. This is the first video in a series related to mental health. We decided to create these videos on mental health crises because of how prevalent mental health issues are within our world. In 2021, it was estimated that over 47 million adults in the United States were experiencing a mental illness. Unfortunately, the number has been increasing steadily over the years. With this prevalence, there's a high likelihood that during our lives, we will see someone experiencing one of these conditions. Being aware of terminology around mental health and knowing a few simple techniques allows us to respond while in remote or urban situations. The term mental health includes several important systems within our body. Our emotional health relates to how we feel. Our psychological health, which is our ability to move through life stressors effectively, and our social well-being, which is how we relate and connect to other people. Mental health is not a black and white idea, which means while we do have the general consensus of what good mental health is, there's always wiggle room for people's differences. One example I like to use is how much time we spend alone. Someone who is more extroverted may spend most of their time in social situations, whereas the introvert may actively seek time alone. Both individuals can have stable mental health. Our mental health is influenced by our genes, upbringing, socioeconomic status, and many other factors within our lives. Everyone has good and bad days with their mental health. We all have had times of struggle that relate to life events such as difficult breakups, loss of a loved one, or felt like we had no idea what we were doing with our lives. These all are included within the condition of being human. Going through difficult times or struggling with your mental health does not mean you are doomed, and it does not mean that you are weak. It simply means that there may be times where we need more support and resources. This is where we hope to help with this video. Someone struggling with their mental health may or may not get to the point of being in a mental health crisis. Similar to the definition of mental health, the term crisis can also be seen as a broader idea with different definitions beneath it. For the purpose of this video, we are going to use crisis in the same context as an emergency. We are talking about the moments when someone's behavior is putting themselves or others in danger and they are not able to take care of themselves effectively. Before we dive into handling a true mental health crisis, it's important to first talk about possible preventative measures. While we aren't always able to prevent these emergencies, keeping an eye out for red flags and taking action before the emergency arises is best, especially while in the backcountry. If you have experience within any type of guiding job, whether it's rafting, ski touring, backpacking, or other activities, you know the importance of paperwork, both for the people working in the field and program administration. To make the pre-trip paperwork effective, asking the right questions before starting the trip is key. While we know to ask about physical injuries and an individual's level of experience within the activity, we don't always make a point to check in about mental health. Gathering information about mental health before a trip can help avoid potential crisis and better prepare you to assist a person if crisis does occur. Some things to keep in mind during pre-trip screening are any mental health diagnoses, related medications and their side effects, and the individual's relationship with drugs and alcohol. These can be touchy subjects for people, and they may not always be forthcoming with information. However, as the guide or leader of the trip, opening up these conversations prior to leaving can make the person more likely to approach you later on if they do begin struggling. On personal trips, we likely don't have a formal pre-trip screening process, but we can still gather information about our traveling partners through conversation. It is common to ask someone before a trip where they store emergency medications such as an inhaler or epinephrine autoinjector. Similarly, we can ask prior to the trip how people are feeling and if they feel mentally and physically prepared for the expected challenges of the trip. We may not know much about the mental health diagnosis we see in pre-trip screening, but knowing a few basics can be extremely helpful if a crisis does arise. Let's look at a few diagnoses you may come across. Generalized anxiety disorder, which means experiencing chronic anxiety and worry without a specific trigger. This is different from someone who has a snake phobia and becomes highly anxious when around snakes, or someone who feels anxious when speaking in front of others. Another diagnosis is post-traumatic stress disorder, or PTSD. This disorder is due to experiencing or witnessing some type of trauma, whether it's combat, a sexual assault, or car accident. It's important to know that not everyone who experiences trauma will have PTSD, but those who do experience hyper-awareness of their surroundings, may struggle with flashbacks, night terrors, and have feelings of guilt, anger, and possibly shame. PTSD is also a diagnosis which can include hallucinations. Hallucinations are hearing, feeling, smelling, or seeing things that are not there. Other diagnoses that can include hallucinations or delusions, which are altered beliefs that have no evidence to support them, are schizophrenia, bipolar disorder, and possibly psychosis disorder. We will be diving into these diagnoses in a later video. Next, let's discuss medication. Mental health meds, like any other meds, are used to help the person decrease symptoms. What can be different with mental health meds is the stigma carried around them. It's all too common for someone on these medications to stop taking their meds. Whether they're starting to feel better while on the meds or just sick of the side effects, they may decide to stop them cold turkey. When it comes to meds, we want to ask about any side effects of medications you need to be aware of, such as rashes, low or high heart rate, or tics, and how you can support them with remembering to take their meds. Being out on a trip means a complete shift in schedule. Someone who is great at taking their meds at home can find it difficult to remember in the backcountry. Ask if they know the possible effects that can happen if they miss their meds and watch for those signs. Milder effects could be difficulty sleeping, headache, irritability, or lack of appetite. More severe effects of missing meds could cause hallucinations, delusions, or violent outbursts. Someone starting on a new medication may not experience helpful results until several weeks, potentially months later. Because of the delayed effects of starting or discontinuing medication, be careful when taking people out who struggle with stable mental health and have a recent change in their medication. As mentioned with medications, someone could plan on using the trip you're leading to detox off of drugs or alcohol. A mental health crisis can be created easily when someone's body is accustomed to getting a certain substance and all of a sudden is no longer getting it. I think one milder substance most of us can relate to is caffeine. There have been trips I've been on and either forgot or chose not to take coffee. I definitely experienced the headaches and irritability due to not having caffeine my body is used to. Whether the person intentionally decides not to bring their normal substances, is not able to sneak them in, or any other number of reasons, they may experience mild to severe withdrawal symptoms. The symptoms can look similar to medication withdrawal, with the milder symptoms including insomnia, feeling lethargic and irritable, and the more severe symptoms including experiencing psychosis, which will be discussed more later on. Both meds and withdrawal from drugs and alcohol can cause seizures. For someone who has been a long-time alcohol drinker, withdrawal is extremely dangerous and can be fatal. On the flip side, a crisis can be created when someone brings certain substances on the trip and chooses to use them. Depending on the type of trip you are on, it may be important to look through the personal items that individuals decide to bring. In the unfortunate circumstance that you find yourself out in the backcountry with someone having a mental health crisis, it's important to utilize the same guidelines you would use in any other wilderness injury. Remember, our mind is not separate from our body, and while it may not be as easy to see and address compared to a burn or cut, it is part of our physical body. We may identify the crisis for the individual based on erratic behavior, disorientation, glassy or variant eyes, and signs of paranoia or hallucinations. If you identify a crisis, use the same patient assessment procedure as with any emergency. Scene size up, initial assessment, focused assessment, and treatment plan when handling these situations. As with all patient responses, start with sizing up the scene. Put a heavy focus on maintaining a safe distance when needed and asking other group members or bystanders to step back from the person experiencing the crisis. You still need to consider putting on available PPE, such as gloves and a face mask, to protect yourself from bodily substances. At this point, you don't know exactly what you're dealing with, so take precautions. The person also could potentially have cuts, burns, or may vomit during the crisis. Getting consent can be tricky when someone is in a mental health crisis. They may not have much connection to reality and potentially think you're trying to hurt them. During this situation, you may have to remind the person many times who you are and that you are there to help them. Something to note is that some companies that work with at-risk populations have protocol for physical restraints in a crisis event. If you do work within this type of company, make sure to review policy and ask any follow-up questions during training to make sure you understand when and when not to use these restraints. In the event of a mental health crisis, as you're going through the scene size-up and gathering your impression of your patient, you'll most likely be noticing some changes to the person's demeanor or mental status. Continue through the initial assessment, stopping to fix any airway, breathing, or circulation issues. If they are not able to stay still or do not want you to touch them, do your best to ask them to show you or help with the process. Next, we need to determine neurological deficit. During the determination stage, we can look at the possibility of a spinal injury and identify any altered mental status. Assess the scene for an accident that could injure the patient's spine. If the patient is experiencing a decreased level of responsiveness, consider causes beyond mental health crisis such as diabetes, heat stroke, or a brain injury. If the person's allergies are known and they can maintain their own airway, it will not hurt to offer a snack bar, water, or something to keep them warm. These actions can go a long way in de-escalating the situation, protecting the patient from the environment, and helping you rule out some causes with altered mental status. As you are continuing to notice an altered mental status, consider possible mental health issues. If possible, gather information from other group members who may have noticed when the changes started to occur. If the person is coherent enough to respond, ask about any mental health diagnoses and ask about any recent changes with meds. The person may or may not be honest with you, but do your best to normalize this conversation. These topics can carry a lot of difficult feelings for people. Once you have gathered a solid amount of information, you need to create a treatment plan. To make the plan, we need to know more about the different conditions that may occur. A treatment plan may or may not include an evacuation. Next, I'm going to cover several specific types of emergencies and actions that can be taken. These will help give you a guidance on several mental health issues that could occur. Let's start with psychotic episodes. When someone experiences a psychotic episode, their mind disconnects from reality. 3 out of 100 people will experience psychosis at some point in their lives. It can result from a mental illness or a physical condition. These episodes can include hallucinations, delusions, and erratic behavior. It can be scary for onlookers and terrifying for the person within the psychosis. Someone experiencing a psychotic episode may begin talking to people that are not there but seem completely real to them. They may experience paranoia and think someone is after them or act suspicious of people within the group. With a psychotic episode in the backcountry, we must maintain a focus on safety for everyone present in the scene. Beyond managing the scene, our goal should be to bring the person out of the field to be seen by a mental health professional. For a milder case, this person should see a psychiatrist and begin therapy as soon as the trip is over, but could potentially finish out the trip. For more extreme cases where the person is in danger of hurting themselves or others, this is an immediate evacuation and the person needs to go to the nearest ER. If you are in the backcountry with someone experiencing a psychotic episode, you do have some choices. If they are experiencing milder symptoms but are willing to listen, find who they trust most within the group. This person can be their go-to for check-ins. There have been times where I would be the check-in buddy for someone experiencing a mild episode, and they would randomly ask me if I could hear the music playing, which I could not. Calmly, I would let them know, and we would try to focus on something else. Now, if the person has escalated in any way and is in danger of hurting themselves or others, evac immediately. This may be a satellite call to the police and moving the rest of the group away from the person who's experiencing the episode. Another condition that you could potentially see within the backcountry is someone experiencing a panic attack. Up to 35% of the population will experience a panic attack at some point in their lives. A panic attack typically looks like a feeling of pressure or pain in the chest, difficult labored breathing, increased heart rate, and feelings of panic. It's common for the person to believe they are having a heart attack. A panic attack can be something the person experiences often and has the diagnosis of a panic disorder, or is something they've never experienced before. If you see someone possibly experiencing a panic attack, look at the situation before making any assumptions. Are they doing something completely new to them, no matter how small or insignificant it may seem to us? There was a situation where a teenage girl was sent from an inner city to a wilderness program in remote Utah. At night, she became terrified because she had never seen the night sky due to the light pollution where she had lived all of her life. Being outdoors puts many of us into new and scary situations. Whether it's the activity we're trying, being away from our phone or a proper toilet, not being able to shower, it's easy to become overwhelmed, which can lead to panic. While panic attacks can be situational, it's still important to monitor someone who has experienced a recent attack. If the person begins having an attack, first start by stopping the activity as soon as possible. Move the raft to the side of the river and back away from the edge of the cliff you're going to rappel down. See if the person will sit down with you. Ask them to take deep breaths with you and keep encouraging them even if the person says they can't. Another helpful exercise is getting them to move their attention to some external stimuli. Ask them to name 5 things they can see, 5 things they can hear or smell. Ask them to describe these things and bring their attention back to the external focus. This may take time, but the person should begin calming down and breathing at a more normal pace. It is possible to pass out during a panic attack, so keep this in mind with your location and be prepared to protect their head. If the person begins having panic attacks frequently or is not able to calm down after a couple of hours, we need to begin looking at possible evacuation options. This could be due to a physical condition or issue that needs to be handled by medical professionals in a hospital setting. Another crisis situation could be due to someone experiencing what's called a manic episode. A manic episode is commonly associated with bipolar disorder. About 1 out of every 100 people meet criteria for bipolar. There are 2 types of bipolar, one having more severe mania and bipolar 2 having what is called hypomania or less severe episodes. They both experience cycles of depression. Mania is characterized by erratic behavior, high energy, lack of sleep, and difficulty staying on topic. Full-blown mania can include incredibly risky behaviors. In the backcountry, the biggest concerns will be around the person getting lost or hurting themselves by making a poor choice. Some examples could be going too close to the edge of a cliff, not using safety equipment such as PFDs while boating, or deciding to go on a night hike and getting lost. In a situation where mania is present, your focus should be on trying to mitigate risk and assess the need for an evacuation. If the person is showing milder signs of mania, such as pressured speech and high energy, it's very possible to stay in the backcountry. If the person is not able to follow direction and follow safety protocols, this is when evac is needed. With manic episodes, the concern is with the person hurting themselves due to risky behavior. Of course, within the backcountry, one person injuring themselves can put the entire group at risk. The other part of manic episodes that is important to consider is the lack of sleep. People experiencing manic episodes may not sleep for several days or get 1 to 3 hours and report feeling rested. A lack of sleep increases their chance of risky and impulsive behavior. The larger concern within this is a possibility of going into psychosis. As we spoke about before, psychosis can bring out paranoid thoughts and possible violent behavior. If someone is exhibiting possible signs of mania, I would encourage doing night checks and not assume the person saying they got a good night of sleep means more than 1 to 3 hours of sleep. As we know within the backcountry, just because we've decided an evac is needed does not mean this is a quick process. If someone within your group is exhibiting signs of a mental health crisis, take the necessary steps to keep the rest of the group safe. This may mean moving the rest of the group a little ways away and having 1 to 2 people stay with the person. It's inevitable in this situation that other group members will be confused and scared. Make sure you're communicating calmly and directly with them and answer questions as best you can. When speaking with the person in crisis, again, be calm and direct with your language. It's always smart to maintain a cautious body position, which means not facing the person directly, but keeping a quick exit if the person does become violent. Direct eye contact and body language can also just be intimidating for someone in distress. In most instances, I would not recommend physically touching the person because this can be triggering. If the person is standing, see if they will sit down with you. Avoid trying to argue with any irrational thoughts or beliefs. This is not helpful because it doesn't feel irrational to the person, and this will definitely cause them to escalate. When someone is in crisis, it is common to feel completely out of control, which is terrifying and overwhelming. Find small choices to offer them. Examples would be asking if they're open to sitting and offering 2 choices of where to sit. We want to give no more than 2 to 3 choices so it stays simple and does not become more overwhelming for the person. Handling a mental health crisis in the backcountry can be tricky. Just like with any type of medical emergency, there are always nuances which can completely change the situation. While we did talk about some milder situations when we can use some basic skills while still staying out, if someone is in a full-blown mental health crisis, which means they're in danger of hurting themselves or others and are not able to take care of themselves effectively, we need to focus on evac and keeping people safe while the transition happens. Maintain situational awareness and scene safety throughout, and focus on what you can control in the situation. If you're interested in learning more, please look at the resources in the description of this video. Thanks for watching and stay safe.